and on their health. So what are the solutions which can build resilience whilst protecting people's health? And then also, what are the solutions which can help mitigate against climate change, so reduce greenhouse gas emissions in ways that have health co-benefits? So, examples of those could be reducing pollution from traffic and also traffic-related travel, but then also planting trees to help absorb greenhouse gas emissions, but then also provide added benefits like shades to people. So that's kind of our the overview of our climate change program and its 4 goals. I head our capacity and field development program, within which this consultation is helping to inform our investments. And within our capacity and field development program in particular, we really want to help catalyze the climate and health field in Africa. And this means focusing not just on researchers, but then also the community of actors, including policymakers, decision makers, affected communities. It could be NGOs, the media, communications experts, who are critical to ensuring that that evidence that's generated is actually implemented to drive change in the real world. We want our investments to respond to African-led priorities and to catalyze action quickly within a timescale of potentially 5 years. And to achieve this, we really want to understand how our funding can help to catalyze the wider ecosystem, both of researchers and then all the other stakeholders that I just outlined. And we also want to avoid funding in silos. So we are not just interested in funding research into the health system and the health sector. We recognize that there's a lot of determinants of health that lie outside of the health system, things like agriculture, land use, water and sanitation, the way buildings and roads are designed, for example. So we really want to ensure that our funding supports researchers and stakeholders who are working on all these different sectors to come together to work collaboratively, because that's the only way that we can really help protect people from the impacts of climate change, both today and into the future. And so today's consultation, as Leah was outlining, is really aiming to explore approaches to transdisciplinary research. And what we mean by transdisciplinary research is research that is co-created with researchers from different disciplines. So they might be health scientists working with climate scientists, data scientists, those working in the social sciences, together with researchers and stakeholders who are working across those different sectors that I said were really important, like agriculture or water and sanitation or land use. And also the affected community. So the research is designed together with the research users to ensure that it's going to be relevant to solving the challenges that people are currently facing towards helping protect people from the health effects of climate change. So we really want to understand, as part of these consultation activities, what is already happening, what the barriers have been to transdisciplinary research and action, and most importantly for us, what are the opportunities to really scale up that action and help further catalyze the climate and health field. So I'm very much looking forward to the discussions today. ARIN will be doing, and APHRC are also doing some regional consultations and interviews as part of this wider research project. And we're looking forward to the final findings from those being released by the end of April. So thank you so much for taking part today. And I'll hand back to you, Leah, to proceed with the rest of the meeting. Thank you.
Thank you so much, Modi, for sort of helping to set the scene around the discussion that we'll be having this afternoon. I'll now invite Dr. Martin Muchangi. Kindly do confirm that you can hear us. Dr. Martin?
Yes, I can hear you. Leah,
yes.
Can you hear me?
Yes, I can. Please go ahead.
Okay. Good, thank you. I am having a very unstable network, so should I find it necessary to switch off? I'll just switch off. Yeah, so
yes.
colleagues, I'm so happy to be here. Okay, good. Once again, my name is Dr. Martin Muchangi. I work in South Africa. It's an African NGO. Mission is to create trust in health change in Africa. So today, my conversation is going. Yeah, one, I just want to appreciate where we are coming from, and really building about the conversation of the Libreville Declaration. And then number two, I'll speak to the progress that we have attained so far, what we need to be looking forward to, and especially putting research, the research agenda at the center. So once again, just redounding that the wisdom of integrating the actions around climate change and health was really founded properly in the year 2008. That doesn't mean previously that we did not have some initiatives which were looking into like integrating climate and health, but their scale was quite limited. And so for that case, we always take Libreville Declaration as the foundational initiative where we can easily say that that's where the real integration of these actions began. And so ministers of health and ministers of environment came together from about 52 countries, and they endorsed that declaration, which spoke to a couple of things. Core to this was like inviting the two sectors to already start thinking about strong governance systems, think about strong capacity building initiatives, think about the issues around research and gender, think around the issue of integrating the actions. And that journey somehow progressed very well, up to the point where countries began developing the national plans for joint actions between climate and health. But at the same time, let me say that there has been some weaknesses because WHO and UNEP did very well. But the African countries which signed to that in a big way, largely because of either funding or other issues, have not been able to push that agenda forward very well. Now, at the same time, because the impacts of climate change are really pushing the health sector to the corner, the sector has been inviting itself to think about the key things that it can do to come to the tables of negotiation, attract investment, ensure that evidence is put on the table so that any kind of arguments are like authentic. So for that case, I'll speak about some of the initiatives that Wellcome Trust, WHO, and other partners have been part of, which is the development of the Pan-African Common Position on Climate Change and Health. And this is something which we did sometimes last year in the run-up to COP28. And so what we did is we gathered a couple of partners to come to the table, led by the African Group of Negotiators and with a couple of governments, to come and bring forward the core imperatives that the health sector thought was important and necessary to push forward to COP. So that paper is out, and at the end of the day, I should be able to share that with you so that you can see exactly what the Africa region invited itself to us. Now, moving forward, that was used to build the case around the COP28 declaration on health. And I think I'm so happy because when you look at the participation of the health ministers, when you look at the participation of the health sector, it was actually very, very well attended. And so we were able to articulate like, our pain points. And the good thing is looking at the final decisions and especially referencing the one document around the global goals on adaptation, we are very clear that we have an entry point as a health sector. Now, the question is, do we have the metrics that we can put onto the table? We have clear indicators that we can put onto the table and say that the health sector moving forward will be using this to track its actions. So that's a question which we are trying to answer right now. And I would want to state that there is a meeting which is being organized by Agnes. Agnes is the African Group of Negotiators Expert Support. It will be in Nairobi, basically preparing for pre-SB. It will be a pre-SB meeting. SB is the scientific body on science and technology. That is under UNFCCC. So we want to make sure that by the time when we go to Bonn, we will be very clear about the indicators that we are putting onto the table, the evidence that we are placing onto the table for discussions and all that. Now, that brings me, as I come to the end, to speak about the role of research. I know there are so many entities that are struggling to bring forward the findings, evidence, and research onto the table. But whereas that is happening, we are still very disjointed. And that's why I would want to thank Aline and also welcome Trust once again for bringing forth this initiative whereby you help scientists, you help academic institutions, and those who are involved in research to speak to each other and to bring the evidence into one, pot. So, but the question is there a way we can craft a movement or a system or an institution that is able to coalesce all these researches and start this? So that's a question, and we need to invite ourselves to really do that. And then the second thing is that the young researchers, in strong cases, handhold them and as evidence is actually properly assimilated. So those are we need to be carrying forward. And at the end of the day, I want to summarize it into, like, for the sake of remembering, carry the following 4 P's. Number 1, if we don't have partnerships, then that will be a problem. We need to think about what kind of partnerships that we need to build. So that's the first P. The second P is people-centeredness. I already know that we, the scientists, work so hard to bring forth the empirical science on the table, but we ignore the citizen science. So, and citizen science, really listening to our communities in their best element, coalescing that knowledge in a manner that it can be bookable, and then using that to corroborate the empirical science. So that's point number 2. The P number 2 is people-centeredness. Then the third P is around public investment. I want to challenge ourselves. If Wellcome Trust was not investing in this, would a country or a government in Africa put forward its money to do that kind of things? So public investment is something which is really so key. And then lastly, all that is supposed to help us to achieve precision public health. We've seen a lot of wastages, we have seen a lot of generic kind of programming, and without proper research, that is likely to continue. We don't know very clearly what are the costs of actions, what are the costs of inactions, and without that, we are not going to get our continent out of the wounds that it is in. So, Leah, I want to stop at that and thank everyone so much for listening to me. Thank you.
All right, so partnerships, people-centeredness, and public investment. That is from Dr. Martin. Thank you so much for your insightful contribution. At this point, I'd like to invite us to react in the comment section. I also understand that you're going to be displaying a Mentimeter, so kindly look out for that. Are you sort of ready with the Mentimeter? Emily, please. In the meantime, I'll just reintroduce our next speaker, who is Dr. Marwa Suraj. Dr. Marwa Suraj, who is joining us. Are you on call? Kindly please confirm.
Hello, could you kindly give me a minute? I will be sharing slides.
Yes, please go ahead. That's very fine. We can see you.
Perfect. If you could kindly wave if you can see my slides.
Yes,
Perfect.
we can see your slides.
So, hello everyone. Thank you so much for having me. There's so much to share, and I know I just have about 15 minutes to share my thoughts. And it's my first time joining this group. Thank you all so much for having me. My name is Marwa Suraj. I work with the Canadian Red Cross. So if my name hasn't given it away yet, I'm a girl from Africa with Canadian nationality. My current title with the Canadian Red Cross actually tells you about my portfolio. So I work in health emergencies and community health programming, and I belong to the board of artificial intelligence in medicine within the American region. And so I'm very happy to be here. As we all know, knowledge is most of the experiences I'll be sharing will be from my Canadian context, but we know that knowledge is not static, it's dynamic and transferable. So I'm more than happy to share a few of my insights and learnings. When I talk about artificial intelligence, I've noticed across the board in the American region that there is a paucity of investment in health or climate change and health. And so that's a huge gap I want to put out there. And I'm hoping the participants will have things to share during the plenary. My main areas of focus would be climate change as a public health concern in Africa, the key importance of systems thinking as a tool, strategic partnerships with tech, which we haven't really leveraged within Africa, and innovation driving climate action. Now, the international landscape is something that we are very, very much aware of, and the international landscape is a reflection of what's happening in Africa at a totally different rate. We know that there's an increased frequency and rate of emerging and re-emerging infectious disease outbreaks. We're seeing same in North America, and the trends are within the Northern Hemisphere. So that brings the fact that globalization, we are all one people, and suffering everywhere affects humans anywhere in the world, because the Northern Hemisphere does include most of North America, South America, all of it, and Africa as well. And we've noticed that the trends are very similar across the board. Climate crisis will continue to drive emergence of infectious diseases and subsequent epidemics and pandemics. We saw that with the COVID-19 pandemic. And is Africa ready for the next major pandemic is a question I'm throwing out there. And are we doing enough? Climate is a multiplier. It results in compounding emergencies. And I'll come back to this when I talk about systems thinking. We've noticed a lot of overlapping hazards. So even though this is the international landscape, we know there's more of this happening in Africa in various pockets with very minimal research outlining the gravity of the extent of these things within Africa. And last but not the least, I want to highlight the fact that we've seen an increased frequency and complexity of emergencies and how it's taking a toll on the mental health and well-being of people, especially on the youth as well. So what's the extent of the impact when we talk about a heating continent? I just wanted to bring to light that while other continents have been almost used to a trend of heating or increase in temperatures, that's annual temperatures, Africa just recorded its highest temperature in history. And so the significance of a heating continent is more significant to us in Africa than in other parts of the world, and they have had time to adjust and adapt. But the question to us is, what does that mean to us within Africa, and how are we coping within the health sector? The consequences of a heating continent actually and surprisingly affects various industries. It cuts across agriculture, the energy sector, water and sanitation, and in my opinion, working together is the only way we can move forward. And health has a way of siloing, working in silos, not just in Africa, but as in Canada as well. And so most of my sharings are based on seeing trends that are very surprisingly similar to what's happening here in Canada. And I believe it's happening in both my countries, Ghana and Sudan, which is ridden by a war.
Sorry, Suraj, to disrupt you. Just kindly requesting that you put your presentation in slideshow if you can.
Absolutely. Does this help,
Perfect.
Leah?
Perfect.
Awesome. And sorry about that. So this is my most exciting slide, and this is something I talk about anytime I meet with people. And it's about systems thinking. And for me, systems thinking is a tool that we don't necessarily leverage in the healthcare sector. I feel like climate and health form a nexus, and we look at them in isolation, and that's why we are not finding plausible solutions. So I'd like us to just take a moment to look at the image here. The image, if you look at the tip of the iceberg, is what the portion that you're seeing with events is called, and that's what's visible. So when you're looking at the sea, what you see is the tip of the iceberg, and what's visible is just about 20% of the events. So when we think about climate change and health, we're thinking about our regular heat strokes that are happening in pockets across the board, especially within the northern parts of Africa. We're seeing that there's an increased prevalence of diseases like malaria and cholera for understandable reasons. But what we are not seeing are the patterns, the structures, and the mental models that actually influence or exacerbate the system as a whole. So for me, systems thinking is a way of analyzing or dissecting, or a decision-making tool that helps you analyze things within a high-risk context. And I call the climate change crisis a public health crisis. And looking at systems thinking and analyzing the 80% of hidden things also help us come up with more effective solutions. So when you look at the patterns level, it talks about economic and infrastructural vulnerabilities, which cut across the board when we talk about our continent. There are racial and cultural factors that are hidden below the tip of the iceberg that also contribute. So these are various levels within the system that need to come together and not be seen as individual parts of the whole system. We know there's an increased biodiversity loss, and Africa contributes to 1/4 of the world's biodiversity. In case you didn't know or didn't appreciate the fact that we are contributing significantly to the genome within the world, Africa is responsible for 25%, and biodiversity loss is happening at an exponential rate within our continent. Environmental degradation also further exacerbates these problems. Now, the most significant for me is the base or the foundation of a systems thinking model, the iceberg model, and it comes down to mental models. And I like to assess this from the context of where you live right now, and this is just a quick reflection exercise for the participants. What's your perception of climate change, and how are you contributing as an individual to the broader solution? Because it starts from the individual, and that's why I highlight a people-centric approach. And I really appreciated the fact that Martin also talked about people-first approach, because it starts with us. We can't expect to effect policy change without changing the way we perceive nature and health. And our planet is our planet and no one else's planet. The question about One Health, is One Health the framework that we could use to propel or catapult climate action in the health sector? I'm leaving that to the participants to discuss further during the plenary. So there's no such thing as talking about climate action without a call to action. So a few things I'd like to share from my little experience. I did talk about a people-centric approach. It starts with us deciding to learn and educate ourselves. And so there's a lot of learning, unlearning, and relearning that has to happen within the climate space. If we don't understand the climate science and its health impacts, then we're not coming from a place of knowledge. And so I believe there are some very free courses out there that can help empower us. I've been on this journey for the past 7 years, and I don't think I know it all yet. And so empowering ourselves with the right tools and right knowledge in a very evolving landscape is the way to go. I believe in the power of knowledge sharing and knowledge exchange, and forming communities of practice. I'm yet to find a community of practice that focuses solely on climate change and health within Canada. I don't know what the landscape looks like within the African region. So kudos to Modi and her team for trying to bring a group of experts in this area. I'll be looking forward to the demonstration projects that come out of these. Exploring strategic partnerships. For me, I believe there are pockets of investments within North America that can be leveraged. if we start to think as climate change as a global problem, because climate-based, and I recommend everyone check out their website, they link people within any sector or any industry to investors that are hoping to invest some monies in demonstration projects. And that comes back to my point on research. And I believe Martin also mentioned the fact that research is important, but focusing on the people and the processes and the policy also matters, right? And in my humble opinion, and from my experience here in Canada, there's so much research can do if we're not investing in knowledge mobilization. So knowledge mobilization has to happen within a spectrum. So yes, research is important. The evidence and knowledge generation has to happen, but that knowledge generation has to be transferred and mobilized into the real world. And that's where climate tech startups are doing a very great job in that space, where if you do believe you have the research to back something, they're willing to invest in demonstration projects. And it's usually held, it's a place that is held by multidisciplinary teams. And so if you're an expert, for example, within the health sector, there will be engineers that will be supporting you, data scientists, and other disciplines who can help bring your projects to life. Something that's really been beneficial within my space is community-based organizations, leveraging the knowledge of the people that are actually experiencing or going through the motions has been very useful. And the Red Cross and Red Crescent movement is a huge federation or framework with about 192 national societies. And I urge anyone here who is affiliated with any of the societies to be open to knowledge sharing and knowledge transfer as well, and knowledge exchange, because that's the only way we can propel the idea of climate change and health, or that's the fact that we need more investment in that space. Advocacy and policy change was articulated beautifully by Martin, so I'm not going to repeat these things. But in our own small ways, we need to support initiatives and campaigns that influence climate and health policies. And I believe that's why I accepted to come speak here, because I found it very interesting that Welcome, led by Modi, is doing such a beautiful job. So I'm more than happy to support such initiatives in my own small way. For this, I've always thought of innovation as not always technology-centric, but it could be about doing all things in new ways. And some of the things we've seen here within my team, and I'm responsible for an entire geography within Canada, which is within Western Canada, and it's Manitoba and Nunavut. Pacific area, we take a significant chunk of Canada. And what we've noticed is if you're doing a small project, make sure it's scalable, replicable, and feasible within various other contexts. And so my little insight in that space is when you're thinking of a project, yes, you're thinking of the African context, but how can that be replicable in a different context? If it withstands the litmus test, then you know that that's an innovative solution to climate change and health. And so I urge people to think in those directions as well. Encourage the adoption of best practices and technologies that have been proven to be effective in addressing climate-related health challenges. Is the summary of what I believe developing scalable and replicable solutions should look like. And that's my final slide. Thank you for letting me hold this space, and I'll hand it over to Leah now.
All right, thank you so much, Suraj, for your useful contribution. I'll invite Emily to sort of take us through the Mentimeter, to just pick our minds on what we are thinking on so far. I'll also invite us to put our questions and comments in the section. I see some of you are engaging there as well. And as we just wait for that to be shown on our screen, I hear systems thinking, I hear strategic partnerships, I hear people-centric approaches and innovation. Also having a community of practice, which is sort of a core objective of this research. And thank you, Modi, for just staying with us. You're hearing all the comments that are coming through, aspects that Welcome Trust can also deep dive into, and just a challenge for all of us. So This is the Mentimeter question that we would be grateful to have your responses. What strategies do you think are effective for bridging the gap between policymakers and researchers in addressing climate change and health in Africa? So just happy to have you sort of write down your comments on that. If you could post it also on the, yes, thank you, Gogo, for that. So I'll just give us a minute or two to put in our responses. We could just sample a few of those that are coming in. Yes, so of course, data sharing would be crucial, information dissemination and capacity building. I'm just reflecting on the sharing replicable and scalable initiatives as well across contexts, simplifying the science and key implications, very important, waiting for more responses, having collaborative platforms, partnerships, strategic partnerships, has been highlighted as well. Embedded solutions to institutionalize research, contextualized evidence. I think this has been highlighted by Dr. Martin as he opened the discourse for us. Integrating human rights, very key to climate change and environmental management. I think also linking it up to the health aspect would be crucial. Talking to each other as opposed to talking to each other, as opposed to talking maybe at each other, between the researchers and policymakers. Use of media. How does this information, how is it packaged in a manner that can get policymakers buy-in, engagement, funding opportunities. Let's have a bit more responses there. Avoid working in silos, which this project has aimed at doing, and perhaps we have successfully done so. Sensitization and capacity building would be very crucial. We have 21 responses so far, just urging more of us to sort of indicate that. All right, so as we continue to gather your responses, I'll now be inviting our next speaker. The second aspect of the Mentimeter is here, and I'd like to invite you to apply your mind to this as well. What role do you see technology playing in advancing transdisciplinary research on climate change and health in Africa? So what is the role that you foresee playing, technology playing in advancing transdisciplinary research on climate change and health in Africa? Akan Hilda in the comments says capacity building, which I think has been underscored by other participants as well. So I'm just waiting for your responses on this.
Hello.
The link is also in the chat. The link to the second Mentimeter has been posted to the chat on the role of technology in advancing transdisciplinary research on climate change and health in Africa. Hadine, you say policymaker initiated empirical research. Okay. Just waiting for more responses. Capacity building and training. I think that also leads to the first aspect. More responses on the second question, please. As you await, Hadin, you say policymakers and donors seeking evidence from researchers, involving stakeholders in designing objectives of a research and throughout the research period, facilitating policymaker research engagement in best of ways, using research findings to influence policy and practice. Okay. Yes, this is interesting. Raymond Rioka, you say technology is the quickest avenue to disseminate findings and knowledge in a timely manner.
Hi, Mayor.
Yes, please. Sorry, there's a bit of an echo, but I invite you, Emily, to intervene. And whenever you
Let them respond on the Mentimeter link, please, and not on the chat directly.
All right, that's fine. So kindly find opportunity to respond on the Mentimeter. Be happy to read some of the comments as well, but kindly respond on the Mentimeter. In terms of the second aspect, Suraj, you're saying utilizing GIS for mapping climate impacts and health outcomes. This is an interesting perspective on the role of technology in transdisciplinary research. Okay. Just waiting to collect more of your responses on the Mentimeter. Emily, do we have some responses? It has been reposted on the chat. Just go to the Mentimeter and post your useful comments thereon. Wilson, you're saying data collection and analysis. In this, we have also looked at in the first aspect of policymakers and researchers. Sensors, satellites, drones, mobile devices, and other technologies can be used to gather detailed data on environmental conditions, climate patterns, health indicators, and more across Africa, including advanced computing. Thank you, Wilson. Just reminding everyone to post their responses on the Mentimeter. Soka, you're saying telehealth solutions, technology. Wow, the term telehealth is really insightful. Technology can improve healthcare access by enabling remote consultation.
Leah,
Yes.
sorry to cut you. The participants are responding, but on the chat, which is not captured on the Mentimeter. Kindly, if everybody could just reach through the link on the Mentimeter through the chat, and then they post the answers on the Mentimeter, this would really help in capturing all these responses later. Instead of posting the chat, please. Emily will share the link to the Mentimeter and let us do the answers on the Mentimeter. That will really help in capturing this.
All right.
Thank you.
Yes. Thank you so much, Gogo. Just as a kind reminder to post your response on the Mentimeter. Emily has shared the link of the Mentimeter on the chat. So great answers, great responses, and inputs that we are receiving. So if we could just take these on to the Mentimeter, it would be great. All right. So Maybe you can look at those that have been posted already, some of the responses. Mm-hmm. Okay, so thank you so much. Would you want to display some of the responses that were on the Mentimeter, Emily or Gogo?
None so far.
Okay, okay. So just urging us all to sort of use the Mentimeter. I know the chat is a bit easy and at hand, but just urging us all to sort of just use the Mentimeter as well, so that we can capture and not lose any information. All right. Did you have a third Mentimeter that you wanted to display before we go on?
We'll do that after the third presentation.
All right, fantastic. So at this moment, I'm going to be inviting Gladys Ngeno, and even as she confirms that she can hear us, I'll be urging more of us to sort of document our responses, our perspectives on the Mentimeter, so that we do not lose any information from the vast expertise that we have on call. So kindly make your way through to the Mentimeter section that has been posted on the chat. Gladys Ngeno, yes, I see your presentation. Please do put it in slide share mode. Fantastic. Please go ahead.
Thank you very much, Blair. Good morning, good afternoon, good evening, everyone who is here for this webinar. I can see we have representations from different continents, from Geneva, from London, from Africa, Saudi Arabia. So this is such an awesome group, and I'm glad to be here. So I'll be looking at some of the new initiatives and potentials to scale up the aspect of transdisciplinary research on climate change and health. And this is really going to build up on some of the global discussions and Africa discussions that have been discussed by Martin and also and Marwa. I don't want to dwell much on this definition of transdisciplinary research. I think Modo really explained it very well. It's really looking at, different types of knowledge coming out from different disciplines, but also looking at, values, knowledge, and know-how and expertise from non-academic sources. So sometimes there is a confusion between interdisciplinary and transdisciplinary. So transdisciplinary is quite inclusive and really correlates to what Martin has mentioned on the 4 Ps, really having people-centered, population, and public investment, etc. And also, I think this has really been discussed a lot about, Africa and the issues of climate change and how it has really affected it's going to affect our health outcomes as we go. There is a projection that by 2050, we are going to have about 250,000 deaths, additional deaths from the impacts of climate change. And hence, really the need to have this a holistic, transdisciplinary, multi-sectoral, and systems thinking approach, as my colleagues have explained. But what is very interesting on the issues of climate change, we usually say, in Africa, there's lower income countries, lower middle income, and then, of course, the other developed countries. And, climate change has brought us together. With the 1.5 degrees increase in global temperature, it doesn't matter whether you're in Senegal, whether you're in London, whether you're in Rwanda, whether you're in South Sudan, all that effect comes to all of us. And that really helps us to start thinking critically. And this topic is very relevant on discussing issues of sovereignty, issues of procurement, and international financing mechanisms. Some of these initiatives that are, have been going on in Africa, and we really all look at the Libreville Declaration. But what I really want to talk about here is the WHO, initiatives on developing the climate change and health toolkit, and really helping countries to even look at issues of vulnerability assessments and adaptation plans. I was just doing some assignment the other day with the Dutch, the Netherlands, and we were just looking in Africa how many countries have the health adaptation plans. That's really a base of research for climate change and health. And I think we only got 6: Rwanda, Ethiopia, Uganda. Yeah, so very few of us have done that. So there is also really a big B&D assessments that really help us look at how the country is, and they're able to focus our research on some of these sectors. And as has already been mentioned, I think the COVID-19 was a wake-up call for everyone. I know the African countries through their Health and Environment Interministerial Conference and even the African Union Climate Change and Resilience and Development Strategy 2022 to 2032 really outlines the aspect of transdisciplinary actions on what you need to do in climate change, but also aspects of health have been clearly mentioned. So some of the initiatives that I've interacted with and seen that are, could we then move forward? One is the V&A assessment, and I've mentioned that very few of us in Africa have done that, since this was agreed in COP 26 a while ago. We already done up to COP 28, COP 29 is coming through, but majority of us, including where I come from, Kenya, we are not yet really done our national V&A assessment. So this is one very informative kind of research that if we could invest in each of these countries to be able to help us map, the 8 climate change risks and how it affects health. And now that will really inform some of the adaptation or mitigation plans we have in the health sector. Secondly, looking at research from planetary health perspective. And I remember 20 or so years ago, we learned in public health that, health is about you and your health-seeking behavior. Slowly that moved into public health. A little of that then moved to global health. And then, recently the issues of One Health, looking at how animals and us interact. And now we are now discussing the issues of planetary health. It means we are one, we are one, and we need to look at health in that perspective. And I see the aspect of transdisciplinary research really looking at planetary health. And I can see for example, some journals like the Lancet has actually put up, a separate page to look at planetary health research. And some of the, research that has been done recently, actually last year, some of them were published last year. One is on how air pollution exposures and non-communicable diseases. This is being done by the Clean Air Africa project. It's based here in Kenya, but it's across 6 African countries. And the second issue is the issue of plastics and exposure. So the planet's exposure to advanced birth outcomes. Now you can see the aspect of environment also coming up towards the health sector. And then the One Health system that I think now the discussion is going ahead, but I think we really need to look at keenly on especially AMR and zoonosis. The third approach is the One Health approach, and I'm glad that has been mentioned earlier. I think, as I've mentioned, we are looking ourselves as one. Yeah, how do we interact between the human, the animal, and the environment? And one of the research centers where I found a lot of published work, not many on One Health. It's called Kabi Digital Library. They are trying to put in all the research on One Health. So this will be able to share with the participants so that you can be able to look at. But I think this is also a very good initiative to invest in, to look at how our interactions with the animals and also environment really looks out in terms of the research. The fourth aspect that I've seen really gaining a lot of momentum is the health systems approach. and the WHO framework on health systems building blocks, I think really applies also on aspects of climate change, because you need to look at the aspect of leadership. How are you financing? How are you getting, the essential technology required? How is data, mined and being used? How the health workforce really, capacity built to be able to tackle the aspects of climate change and health? And I'm sure everybody, I saw some of the responses earlier on Mentimeter, and really the aspect of service delivery. So this is also one approach that we can really think about in Africa on how we can look at climate change from a systems approach and try to build up on that to get more useful aspects. So one other published resilient links is also a journal that actually pulls together journals that have been published on systems approach to climate services for health. So you can check some of the published data there. And the supply chain in the health sector is a big polluter. As I've mentioned, the health sector, I think, contributes about 5% of the global gas emissions. And when you look at the health sector, we use a lot of plastics, the infusion bottles, the syringes, the bins, the liners that we used to throw away trash or waste from the facility. We burn a lot of waste from health facilities. So this also is a very strategic topic to look at when you want to do the aspects of climate change and health research, looking at the risk assessment, but also some of the initiatives like globally the Healthcare Without Harm have, come up with some guidelines on how you can bring the procurement of the health sector, and then the Global Green and Healthy Hospitals, which I know Aga Khan Hospital in Nairobi in Kenya is a part of the network, and I'm sure the other hospitals across the Africa networks. Is really looking at how do we reduce, the emissions from the health sector by having a sustainable supply chain. And then the fifth area that I think we need to really focus on is climate change and health financing. This framework on your right here is, that's like the global framework for financing climate change broadly, yeah? But then what models will work for the health sector, for example, yeah? Do we have carbon financing for the health sector, yeah? What are the return on investment if you invest maybe $1 on aspects of climate change and health? How does that return come to? So I think this is an area that is quite open, and really there's a lot of research and discussion that needs to be looked at in that. So some of the modalities for scaling up, AI has been mentioned earlier, and integration of artificial intelligence on climate change and health outcomes, and really the use of predictive analytics. And I know some organizations like AMREF are trying to build something in their Center for Policy and Climate Research to look at what AI can be actually integrated to the health sector. But with the discussion on the AI, gaining a lot of momentum, there is a global community called the Climate Change AI. So this community, brings experts from the food sector, agriculture, energy, health. Yeah, so they all usually meet bi-weekly through, of course, virtual coffee. Just to, so if you want to join, you become one of the, members in the working group, and then you can discuss, what are some of the AI aspects that you need, maybe for the health sector, for your predictive analytics, maybe for NCDs, etc. So that's a very good resource where people can actually get some information. Secondly, we've talked about geomapping, and I think the issue of participation from the citizens, or the people that actually live in climate risk areas is very important. So especially for climate sensitive diseases, agriculture production, etc., like looking at the whole aspect of climate change and really the impact on health. So University of Washington Center for Health and Global Environment has a very interesting, very easy-to-use tool. It's called a climate health and risk tool. So those who are interested can also have a look, and if it is something that you can research on, also, for adaptation in Africa. Lastly, the last opportunity is really the issue of data. And some of the participants have actually mentioned, why don't we link climate and health data? And we usually hear about, there will be El Nino, there will be droughts, etc. But then the health sector usually comes later when already, the drought has happened, but, the environment folks maybe shared information a month or so ago. How can that then be used or translated to the health planning? And the Africa Development Bank Group has, a link on a database on environment and climate change data for most countries in Africa. And that's also an opportunity we could look at how we can integrate some of the health data inside there. And the New York Environment and Health Data Portal is very interesting. It has everything from the household, the environment, energy, etc. So those are some of the examples, that we can look at moving forward in Africa. And lastly, I think we've discussed some of these ways on scaling up. One is establishing interdisciplinary research centers. I know AMREF and Aga Khan and Development Network here in Kenya are trying to establish a center for research and policy here in Nairobi for AMREF, but Aga Khan Development Network in Arusha, Tanzania. So those are some of the areas that we can also invest in to try and build up some of the research. Secondly, the aspect of multi-stakeholder partnerships. This is very important. We talked about climate change, as aspects of energy, there's agriculture, health itself, all that. Can we then look at the climate change and health through that lens of everyone participating? As we've looked at the issue of planet health is all over. So, for example, looking at, every country on how they have coordination frameworks for climate change and health, making sure everybody is on board. The third aspect, capacity building, I think this is needed for most of our countries, especially in Africa. And I always give an example of my grandmother. We used to plant maize, and 6-7 years ago, it doesn't grow anymore. And when you ask, she says, it's because the rain has changed or the patterns have changed, but they don't understand. So that is just a common person, really not understanding what exactly is climate change. But even our healthcare workers and even some of the policy level teams really do not understand. So capacity building is very important. So looking at maybe even curriculums to the teaching center. Data sharing and collaboration platforms, I already mentioned, really how can we use the data from energy, from the environment, weather, to look at climate change and health. Community-based research and engagement, very important. That has really been mentioned by Marwa, and how we can involve them to planning on climate change. And policy, advocacy, and knowledge translation. This is a very big area that we need to really invest on. And lastly, the funding mechanisms for climate change and health. I think during the COP28 in Dubai, there was a bit of discussion, and there's a bit of a guideline on how to invest, but I think that has not yet been translated to, to action from the different centers. So thank you very much. That's the end of my presentation. Over to you. Yeah.
Thank you so much, Gladys. I think up until this point, really great presentations and insights. Also see some of the comments in the chat section. I'll just invite us, based on what we have had in the discourse that has been going on, to our third Mentimeter question that will be on our screen. And as that, oh yes, great. So responses that we have so far, and if you haven't, please feel free to chime in. How can international collaborations enhance transdisciplinary research efforts, of course, focusing on climate change and health in Africa. So some of the responses that we have are on strengthening South-South and North-South engagements, ensuring that we are having this discourse not only amongst ourselves, but with also targeted stakeholders, international collaborations to enhance cross-learning and knowledge exchange, knowledge translation even on best research practices, crucial, co-creation of knowledge for shared action, providing technical expertise as we richly even have it here amongst our participants, funding, holistic understanding. We've thought about the systems approach. I think Dr. Martin highlighted this. Ms. Ngeno, you have highlighted this, having a systems approach, a holistic understanding to bring together these two perspectives. The Global North, calling them to honor the actions and commitments to finance the mitigation effects of climate change in the South. International collaborations, of course, local relevance by partnerships, equitable partnerships even, to better fit local contexts in Africa, to ensure the findings are relevant and actionable within the African space, having potential to improve efficiency by sharing resources and data, having highlighted and spoken about integrated climate change and health data, learning from positive as well as negative examples. So not just the quote unquote best practices or good practices, but also how can we learn from what has not worked. Promoting community-driven data generation on climate change and health, really appreciating that point because people-centeredness is really the golden thread. International cooperation is the linchpin for addressing the climate crisis, holding a key to realizing the ambitious emission reductions, promoting green subsidies, etc., enabling technological transfer even, crucial to the discussion that we are having. Other examples, funding opportunities, of course, has been highlighted as a crucial need. So at this moment, and thank you for the resources that you've shared in the chat. I've seen that. Yes, I'd like to invite us to any reactions. We will have reactions for 5 minutes. I know there's a lot to react to. There's a lot to question, to comment on. And if you have any of those, I think I'll give 2 or 3 people to sort of raise their hands. If you want to contribute to this discourse, just raise your hand and I'll be happy to give you an opportunity to air out your views, your comments, or your questions. So even as we wait for that, I'll just be reflecting, looking at the chat section. Yes, thank you, Mara Suraj, for sharing the link on an international community of practice. I think this is looking to establish a hub for climate change and health. Just the discourse that we've been having this afternoon, creating and applying knowledge together with the stakeholders to find innovative solutions with more robust and socially viable outcome. I think that is from Akan Hilda.
Hi, Leah.
Yes, Emily?
We have a question in the chat.
All right. Let me look into the same. So Gila Neta is asking, what do you think are the most important research questions to address now? And I want to presume that it's in the area of transdisciplinary research of climate change and health. What are the most important research questions to address right now? Dr. Martin, if you are with us, would you kindly assist us to chime in on that question. What do you think are the most important research questions to address right now in the area of climate change and health? Dr. Martin?
Yeah, thank you so much, Rhea. And yes, I'm here. That's a very tough question, but I think the answer lies with another question, which is, where is the pain point? You know, where is the pain point? And so to begin with, I want to say that the impacts of climate change, the genetic impacts of climate change are quite well known. But the challenge is we don't have micron data. So one of the areas where we need to look into very seriously is, do we have authentic, geographically limited kind of data that can start informing microplanning? So that is one area. Then the second thing is, do we have enough information about disease-specific data? And I'll give you a very quick example. We already know that malaria, yes, is affecting, climate change is affecting malaria and the way it is spreading, or rather even mental health and other kind of diseases. But the question is, do we have deeper insights about all those interactions and how they vary between populations, how they vary between geographies and all that? So, and if you look at Africa, if you are centering yourself at researches around Africa, I'll go with the most pressing points, which is right now, we are still suffering from the effects of communicable diseases. So anything to do with the research around communicable diseases and their interaction with climate change is something which should be so welcome for the governments to start thinking about measures and policies to put in place. Yeah, thank you.
Thank you so much, Dr. Martin. Also looking at Antoine Fay, who is reflecting and saying that, how come no one has talked about the Rockefeller Foundation initiative? Is the representative of Welcome here? So Anton, do you want to sort of just unmute and reflect on that for a minute? Meanwhile, I just sort of nudge that towards our Welcome Trust representative on call, Dr. Modi, if you'd be happy to sort of just reflect in a second on the Rockefeller Foundation initiative, and are there any opportunities for the climate change and health discourse in that?
Sure, thanks. Yeah, I've already posted an answer in the chat. Basically, yes, we're talking to Rockefeller and other funders on a variety of different climate and health initiatives that are being planned and ensuring that there's coordination across them. I think this probably wasn't the forum to talk about Rockefeller's work. It's about, you know, what everyone is doing in this space rather than focusing on specific funders. But if anyone has any insights they want to share that they think we should be aware of, please do, because this is really us consulting to hear what people are thinking about, what's important, how we can add value. But we're certainly talking to our peers as well.
Fantastic. Thank you for that response, Modi from Welcome. So we have Wilson Lemayan asking on the strategy that we are taking to ensure that the youth get chances to participate or be part of the stakeholders of climate change and health. And perhaps I'd like to bring this home to Emily to tell us, as she's conducting the stakeholder consultations and interviews, are the youth involved? Are there any measures to ensure that they are integrated in the process? Emily, if you're with us. Unfortunately, that would be the last question. Yes, please, Emily, go ahead.
Hi, Leah. Yeah, at the moment we are arranging to have our final focus group discussions in the different regions of Africa. And yes, we have incorporated the youth in the plan because we believe their perspectives about this climate change and health agenda is very important. We have a few representatives from the 4 regions, and we would like to integrate their opinions on what they think about this agenda. Thank you.
Thank you so much, Emily. So leadership from all social groups, rated climate change and health data, international and regional strategic collaboration, and of course, people-centric approaches, crucial aspects that we've picked on. I'd like to close the question and answer session, but I see, Sokna, you have your hand up. So I'm happy to give you a minute strictly to sort of chime in.
Thank you, Leah. It's just a quick, wanted just to add what Emily said. The key informal interviews we are conducted to, so that maybe some people are reaching out, please respond, and yeah, we are waiting for your response. And if people are not yet reached out, please, we are planning to reach out to you. This is like doing regional key informal interviews. Thank you very much for attending.
Fantastic. So many thanks to Welcome for helping us to, have this discourse here. I'm going to be inviting our executive director from the Africa Research and Impact Network to give his final remarks. But from me, I have been your moderator, and I've been happy to have this discourse and discussions with you, Leah Aoko. Dr. Atela, can you hear us?
Yes, Leah, I can hear you.
Please go ahead.
I may not be able to put on my video because of where I am, but just to close in 2 minutes or so to say thank you to the participants and the wonderful contributions that the presenters have actually given. We are really very impressed by the case studies and the examples that have been presented as part of ongoing work, because we all know that the agenda around climate change and health is actually just emerging, and there is a really very strong focus on rethinking ways of really creating transdisciplinarity in the two fields, which are actually on their own well developed in terms of expertise, in terms of policies, in terms of capacity building. But in terms of the linkage between the two, that link is still very weak in the continent, and of course, I think the broader part of the South. So while there are really very interesting issues or perspectives that are emerging, including aspects to do with looking at the challenge from a system perspective, the people-centered perspective, issues around coordination. This morning I had a very interesting, insightful meeting with the WHO, and these same issues are actually becoming very important, even at the very micro level, at the national and the local level, because there's already a lot of actions taking place in different pockets. And the question around what all this mean for the challenge in terms of the impact, in terms of creating integrated interventions or solutions for the climate change and health in the continent is something that is going to be a continuous conversation. So while we have these great ideas that need to push the agenda forward, the big question around what exactly needs to be done. If you talk about coordination, if you talk about people-centered, what do we mean by people-centered? What is it? What does it actually entail? And what is happening in that space? And if we talk about coordination, what is it? Do we have some proper or impactful frameworks that have actually emerged or are existing to create some coordination and link actors? Because that's a very fundamental part of the issue. If we don't have adequate coordination mechanism, we are actually going to end up in the same issues that have made this challenge a major concern in the continent, because you can have people producing evidence, you can have people talking about policy, you can have people talking about advocacy, but if they are not coordinated and pathways through which they can be linked, well defined, then it means we cannot create impact. So that coordination perspective is really very critical. But we would like to understand through this work we are doing for on behalf of Welcome, which I must say is one of its kind, because then it's beginning to look at things from a more innovative and from a more systemic perspective, trying to unpack opportunities that really can help us to create much more impactful, collaboration, funding models, capacity building model, research and evidence that is actually, aligned to the issues, aligned to the context, and aligned to the impact that we are looking at. So I want to say this conversation is going to continue, and now we are looking at more targeted engagements, which are expected to help us give some specific recommendations to Welcome. And that is why we are now going to have our regional focused group discussions across the 5 regions of Africa, because we also understand that regional contexts also matter in this issue. But also we are undertaking the key informant interviews. And as my colleague Sokna has mentioned, we really request you to support us in that process. If we reach out to you to contribute to this, we will be very happy. Ultimately, we hope to produce a report that can really not only inform Welcome's work, but also all of us in this space can really draw some insights so that we can be able to take or make our rightful contribution to that space. We will also be producing some key policy briefs that could also feed into the process, even as we move towards strengthening the agenda at the international level at the COP29, which is coming later this year. Otherwise, from my side and on behalf of the Africa Research and Impact Network, the partners, APHRC, of course, other partners who have been part of this process, YADNET, Uganda, I want to say thank you so much for supporting the process. And I also want to take the opportunity to sincerely thank Welcome for really opening up this space so that this conversation can be people-led, and the priorities that they want to support can be centered on the aspirations and the priorities that Africa as a continent would like to see moving forward. Thank you so much. Back to you, Leah.
All right, and with that, do have a good afternoon or morning from wherever you are. Thank you for joining.
Hi, Leah.
Yes.
We can have the last selfie as a norm for those who might be willing.
Oh, yes, please. I'm happy to have us turn our videos on for a quick selfie. Just tell us when you're ready, Emily. Just turn your video on. Let's see your smiles from across Africa and beyond. Are we ready, Emily?
Seconds.
All right, just hold on to your smiles as we end with a selfie. Just tell us if that's captured, Emily.
Good to go.
Oh, okay. Thank you, and have a good rest of your day and afternoon. Thank you.
Thank you.
Thank you. Bye-bye.